Welcome back to my channel. My name is Jamie. I'm a midwife. I've been attending births for over a decade, and today we are discussing what to expect in labor if you're planning on using pain meds. So we're going to discuss why you would use pain medication, what you would expect with different pain medications, and lastly, how to prevent a C-section if you are planning on getting an epidural. Because statistically, it is slightly more likely that you will end up with a C-section with an epidural. Even if you're not planning on using pain medication, this is really important because birth never goes how we expect it to, and it's always good to know what your options are should you need them. First, we're going to start with why people choose to use pain medication in labor. The first is going to be obvious, right? Labor is not going to be fun for most people and often comes with some intense pressure and pain and discomfort. And you just don't want to be in pain before you meet your child. Fair enough. No judgment here. Another reason that you might consider using pain meds, even if you are planning on, is sometimes your labor can be more difficult than expected. So all these coping techniques that you've learned, that we've discussed in other videos, have just kind of gone out the window. If the baby is not in an optimal position, it can cause more intense pain than a typical labor might. And pain meds might be just something to help take the edge off. Along those lines, also, exhaustion is a really great reason to use pain medication. Maybe your labor has gone on for days and you have not gotten any sleep, and even though you were trying to tough it out and not use any pain meds, you're tired and you're exhausted, and you're so exhausted your body can't actually be effective anymore because it needs some rest. And so that is a great reason also to consider pain meds. One that's not really talked about very often because it's uncomfortable is if you have had sexual or physical trauma, labor may stir up some feelings associated with that may be very uncomfortable and traumatizing. So that is a really good reason to consider using pain meds in labor. So what to expect with different pain medications. If you are getting nitrous oxide, commonly known as gas, not all hospitals offer this, but more are starting to. Nitrous oxide is given by mask and it's really temporary. So if you were using it, it would be something that you would breathe in at the start of a contraction to kind of just help numb that pain. And then it fades also as the contraction goes away. You take a break, the next contraction comes on, you would breathe it in. This can be really helpful, especially towards the end of labor when it's really intense. And even when you're pushing, that can be a really helpful tool to use. Then you have IV medication, which is typically narcotics. If it's towards the end of labor, this will not be an option because it can't be given as it gets closer to the birth because it could affect the baby. So if you are 8 centimeters or more, that they may not offer that to you. What you would expect if you do IV pain meds or narcotics is they would give it to you through your IV. You would be restricted to the bed because it's not safe for you to move around while you have this, but it's a temporary thing. So it doesn't last all of labor. At most, you can use it for a couple doses for about 2 hours of pain relief. Now, this is a great tool if you are hoping to avoid an epidural for various reasons, but you just need a break. It's not going to numb your body the way the epidural will, which we'll talk about in a little bit. It will give you a temporary sense of like, you just don't care as much. Honestly, if you have ever been drunk or drink, it's kind of like that, where you're like, I'm aware this is going on, but like, it's fine. It doesn't seem as intense as it was. So that can be a great tool to get a little bit of rest and a little nap, and then carry back on with being able to move and get up and have some freedom of movement throughout labor. All right, so if you are planning an epidural, these are good things to know ahead of time so that you know what to expect going into labor. If you walk into the hospital in labor and it's to the point where you're like, oh, this is really uncomfortable, I want an epidural, they're not going to be able to give it to you right away. The reason is because you're going to need to be, first of all, admitted in labor. So you have to get through triage and then to your labor and delivery room. Then you will have to get a bag of IV fluid before they will even give the epidural. So just know, if you think these things are kind of instant, it can take up to an hour after being admitted until you are getting an epidural. If you are at the hospital, you're having an induction, it's not necessarily going to take as long if the anesthesiologist is available. That's always the risk, that they are off doing something else. You will already have been given bags of IV fluid, and so it can be done quicker. So as soon as the anesthesiologist is available, then you can have it. They will likely ask the partner to leave the room, or any support people, friends, family, doula, whatnot. Occasionally they will let the partner stay, but it depends on the anesthesiologist's preferences. What they will have you do is sit on the edge of the bed and curl over into a C. Often the nurse, or if they let your partner, will be there to kind of support you during this time. Now, once it's placed, it's actually pretty quick how effective it is. And as the medication starts to wear off, they will give you a button to press to kind of top it off if you're starting to feel a little bit more pain come back. The things to know when you are getting an epidural is you are then restricted to the bed. There's no moving, there's no getting out of bed to go pee. It is difficult to change in a variety of positions, though it's not impossible, and we'll talk about that in a little bit, but you are there until the baby comes. So because you cannot get up to use the bathroom, they will likely insert catheter that will stay in until pushing or after the baby's born, or if they don't insert one and leave one, they will periodically empty your bladder because it is important to keep the bladder empty so that the baby can move down, and because, again, you cannot get up and use the bathroom. You will also have to wear a blood pressure cuff, and it's not uncommon that women experience their blood pressure drop once the epidural is in place, and they will give you meds to compensate for that. That's not uncommon. In addition to that, it's also not uncommon that labor slows down with an epidural, so it may be that they give you Pitocin to help contractions pick back up again. All of that, good to keep in mind when planning to get an epidural. The epidural itself is not the thing that is going to cause women to be more likely to have a C-section. It's the things that are associated with an epidural that sometimes increase the chances. So today we're going to talk about what to do to decrease the odds of ending up with a C-section if you want to have an epidural. The first thing that I stress to everybody is getting the baby in a good position either before labor or during labor. If you are planning an induction, you know when you're going to go in, and this is important. Or if you're in early labor before going to the hospital, this is important. There's a series of poses called the Miles Circuit. It's a series of 3 positions that, if done, help get the baby in an optimal position. So the baby is not posterior, not causing back pain. It is in the easiest way for them to come out in the smallest diameter. So start with that. Then try to avoid getting an epidural as soon as you can. If you can wait till labor is well established, you're getting regular contraction patterns, they're strong, they're productive, they're causing cervical change. Typically this is around 5 or 6 centimeters. It's going to go a long way for your body continuing to be able to be effective. Now, the third thing is a peanut ball. It's kind of like a yoga exercise ball, but is shaped like a peanut. A lot of hospitals actually have these available now, so it's something that would be important, especially if you're thinking about an epidural, to ask beforehand to know if one is available. And if not, and you do know that you want an epidural, this is something that you might want to actually purchase and just bring with you. Why it's helpful is during labor, while you are restricted to the bed, either your support people or the nurse can help rotate you in different positions and use the peanut ball between your legs to help keep the pelvis open and make room for the baby to continue to come down and descend. I have seen it work wonders. I think that they are amazing. So to sum up today's video, there are multiple reasons that people will consider using pain medication. There are multiple options for pain medications depending on the type of birth you are hoping for. And there are ways to prevent C-sections if you are planning on getting an epidural and want to decrease your risks. Hope that helps. Looking forward to seeing you soon.